There are more questions tonight about why a doctor accused of putting dangerous drugs into IV bags was on the job in the first place. Fox 4's Lori Brown live at the Baylor Scott & White Surgicare in North Dallas where it happened. Lori.
Clarice, this criminal complaint says that Dr. Reynaldo Ortiz gave up all of his clinical privileges to practice at what's called Facility 2 back in 2021. But he continued to practice here at Facility 1. I've been asking Baylor Scott & White for days if they knew that Dr. Ortiz had given up his privileges at Facility 2. But today we learn that facility is owned by the same ownership partnership with Baylor Scott & White. Dr. Reynaldo Ortiz Jr. was under investigation well before his arrest in connection with 11 patient emergencies and a doctor's death at this North Dallas Surgicare Center. The anesthesiologist was accused of negligence in 2020 at a Garland Surgery Center where he also worked. According to court records, Dr. Ortiz did not recognize the patient's inadequate oxygenation and ventilation, and the patient had to be resuscitated with CPR. But instead of having his privileges revoked, Dr. Ortiz relinquished all clinical privileges at the Garland facility. That was in April 2021. He was still able to practice at the North Dallas Surgery Center, where the criminal complaint against him says a similar issue happened in May 2022, involving a patient who stopped breathing under Dr. Ortiz's care. Between May and August of this year, prosecutors say Ortiz tampered with saline IV bags, causing multiple patient emergencies. We asked Baylor Scott & White, the majority owner of both the Garland and Dallas surgery centers, why Dr. Ortiz was allowed to keep practicing at one facility after relinquishing his privileges at the other. The company told us, "We have actively assisted authorities and will continue to do so. As such, we will continue to limit our comments." Robert O'Shell is a retired associate director from the National Practitioner Database run by the U.S. Department of Health and Human Services. He says this case is an example of why there is too much secrecy surrounding doctors' records.
Right now, you can find out more information about whether your toaster has been recalled and is unsafe than you can find out about whether your doctor's, in effect, been recalled by a licensing board or a hospital. Perhaps for unsafe practice or maybe problems of behavior.
The Texas Medical Board did order disciplinary action and monitoring of Dr. Ortiz for the 2020 Garland incident, just weeks before his arrest in the Dallas cases. O'Shell says legally, if someone surrenders their medical privileges instead of having them revoked, the facility is required to report that to the National Practitioners Database. But the database is only available for hospitals and medical facilities to view.
Why the secrecy? Basically because back in 1986, when the law was being considered by Congress, the American Medical Association was adamantly opposed to having the information be made public. They thought it would damage physicians' ability to attract patients and that people wouldn't understand. It was information that I would want to know as a patient if I was going to select a physician.
I've asked a spokesman with the Texas Medical Board how many complaints the board has received about Dr. Ortiz. I have not yet received a response.